Hearing, Ms. Lawhead, will you please call the witness to testify on behalf of the administration?
Michael Resnick, Commissioner of the Philadelphia Department of Prisons.
Good afternoon, Council President.
Good afternoon, and just state your name for the record, and
Sir.
please speak into the microphone.
Sure. Michael Resnick, Commissioner, Philadelphia Department of Prisons. And give me a second, because they keep making this print smaller. All right. Good afternoon, President Johnson and members of City Council. I'm Michael Resnick, Commissioner of Philadelphia Department of Prisons. Joining me today are Xavier Buford, First Deputy, Commissioner Greg Vrado, our Chief of Staff, Deputy Commissioners Jeremy Nash and Morgan Jaco, and unfortunately, Dr. Herdman, our Chief of Medical Operations, is out, ironically, with the flu. I am pleased to provide this testimony on the Philadelphia Department of Prisons fiscal year 2026 operating budget. The mission of the Department of Prisons is to provide a secure correctional environment to detain people accused or convicted of illegal acts and prepare them for reentry into society in a clean, lawful, humane, and safe environment. PDP offers job training, educational services, parenting classes, substance abuse services, medical services, behavioral health therapy, individual counseling and group therapy. PDP helps advance the mayor's goal of building mutual trust and safety in neighborhoods by ensuring that returning citizens have access to resources to support their successful reentry into the communities. To elevate the city's focus on reentry, in 2019, the Office of Reentry Partnerships, or ORP, a unit within the Office of Public Safety was created to act as the umbrella agency to coordinate, maintain, and expand public-private partnerships across the city to ensure linkages to community services post-release. PDP, working with ORP, has ensured that there is a continuum of reentry services after release for people incarcerated at PDP. This partnership has ensured a critical role in the city's efforts to reduce recidivism as criminal justice reform in Philadelphia evolves to focus on community reinvestment and reentry. Plans for fiscal 2026, the PDP will continue to increase our staffing and retention to improve the security of our facilities. We will continue to provide increased out-of-cell time to enable the population to receive more services and programming. PDP's delivery of such services and programming includes medical and mental health care, substance use disorder treatment, and education and literacy programs for inmates, but especially individuals from vulnerable and underserved backgrounds in preparation for the release back to the community. PDP is a 24-hour per day carceral operation and requires continuous staffing. Because our facilities operate around the clock, they need ongoing preventative maintenance as well as routine and emergent upgrades to modernize the infrastructure and equipment. PDP continues to address staffing challenges in collaboration with the city's Central Office of Human Resources to attract candidates to fill vacancies. PDP has retained a recruitment coordinator and contracted with the Walls Group, a firm that specializes in the recruitment and hiring of people specifically interested in working in law enforcement. Over the past year, PDP's double-digit attrition rate dropped to a low single-digit attrition rate. The PDP attributes this to staff pay increases, an aggressive hiring campaign, and the opening of our new training academy and fitness and wellness center at the former site of the Alternative and Special Detention Unit. PDP's spending largely stems from the policies, professional standards, and operational priorities established by its contracted medical, behavioral health, food, and maintenance contracts, and associated staffing costs from collective bargaining agreements. PDP's budget supports required services for the incarcerated population and aligns with its operational goals of providing food, medical care, ensuring the maintenance of its facilities while pursuing the resumption of full operations. Our plans for fiscal 2026 and beyond are broad-based. Consider areas throughout the Philadelphia Department of Prisons to support our primary goal, which include, as I said, the PDP will continue the top priority of hiring through the promotional efforts of our recruitment coordinating team with Walls Group. PDP will continue a partnership with the criminal justice system partners in achieving the goal of lowering the jail population. PDP is currently undertaking a comprehensive assessment of our restorative and transitional services division, which includes but is not limited to discharge planning, education, counseling, vocational skills, and reentry services. By the summer of 2025, working in partnership with the Office of Reentry Partners and other stakeholders, PDP will open its new reentry services trailer located on our grounds. This will allow returning citizens to receive linkages to community services directly upon release. PDP will continue to provide medication for opioid use disorder to incarcerated individuals with opioid use disorder. PDP will continue to provide correctional staff with professional development, continuing educational opportunities, and wellness and fitness programs. This will allow us to maintain the highest level of professionalism among our staff, supporting current theories and practices while staff interact with incarcerated individuals and maintain their personal safety, along with increasing staff retention. In the spring and summer of 2025, PDP is planning to pilot a medical monitoring bracelet for all newly admitted inmates. This system will monitor inmate vital signs and alert staff if immediate medical intervention is needed. I'm happy to answer any questions that the council may have.
Thank you very much, Mike, and one, congratulations on your position. You have a track record of good work.
Thank you, sir.
Working with members of the city council, and so when I saw the mayor appointed you to that position, I knew she got the right decision.
Thank you.
Got the decision right in terms of you taking Department of Corrections to the next level and addressing the various issues that need to be addressed. So I have a couple just brief questions, and then I'm going to turn it over to my colleagues. I just want to get an idea of how are we managing staff to inmate ratio around public safety, right? Addressing the issue of K2 amongst inmates, cell phones amongst inmates, well, contraband amongst inmates, and their safety. Obviously, there have been reports of, based upon the, and you can correct me if I'm wrong, the lack of staffing, inmates being locked down for a significant period of time, maybe not having an opportunity to use the phone. But give me an idea where we're at, just the state of our prison system.
Certainly. So I'll start with staffing first, Council President. So since I started in April of 2024, we have hired 230 correctional officers. Okay. We have net gained 174. We had 56 attritions. We went from a vacancy rate of 47% down to 34%. Not great, but we're going in the right direction. We currently have a single-digit attrition rate, which is remarkable since we were in double digits previously. We have a brand-new academy, renovated it, opened it this year. We can simultaneously train 2 classes of approximately 60 each and have room in an auxiliary space to train current officers on their required in-service training. Currently, we have a class of 58 in the academy that will graduate in 2 weeks. Our next class that will start on April 14th will be 74. That's the largest class we've ever had. We have also worked with the city and our other partners in the administration to change the civil service rule to allow staff members who have left the system within the last 5 years to return to their old position. The rule used to be 1 year. So we have about 25 individuals who have come back since that rule change. We sent letters to everybody who had left in good standing in the past 5 years, and so far we're about 25 individuals. We put them through a mini academy just to refresh them and put them back in the facilities. We have probably maybe 10 or 12 individuals in that category to be reinstated again. So the situation that arose that caused us to be in this situation where we're in this settlement agreement and the REMIC litigation was because of a lack of staffing. Everything we do is determined upon our staff allowing good order, good security, inmates being out, going to their programs, getting the treatment that they need. Our population today is 3678. That was down from a high of 4,800 in September, I believe it was. So we have less inmates, we have more staff. So we are getting to the point where we are opening the jails almost the entire days. Inmates are getting out of their cells for the better part of the day. In the past, when our population was higher and our staffing was lower, what we would do is open a bottom tier for 2-3 hours, and then open the top tier for 2-3 hours. And that, as you can imagine, was not an ideal situation, not for the population and not for staffing. So we're getting to the point where we are able to open the jails fully. Deputy Commissioner Nash, right here, has been working with all the jails to put together what normal operations in a normal day look like, and we started out-of-cell trackers to make sure that we're adhering to those things. You mentioned contraband, sir. It's dangerous for the inmate population, dangerous for the staff that work there. We've undertaken a bunch of new initiatives. We expanded our canine unit, and our canine unit is contraband detection dogs. That's what they're trained to do. So we've expanded that unit. We have an entrance procedure unit that mans our Tech 84 machines. These are our, you've probably seen them in the airport, those scanners that scan you to see if there's anything on or in you. So our staff go through those, the inmate population goes through those. We have new mail scanning machines that detect any drugs or anomalies that come in on the mail. We have a new security and intelligence unit that sole purpose is to interdict contraband, and they've been very successful. So we're taking many proactive steps to ensure the safety of the facilities, and that will come as we increase staff and work with our justice partners to maintain this population level.
And last question, in terms of the Department of Corrections, what is your IAD unit?
Where is it?
Where is your IAD unit?
IAD is currently on Byberry Road. They're in a facility, I believe it's an old fire facility. They're off campus, and the theory behind that was keeping them away from campus so that people didn't know who was generally going to IAD to be interviewed or make a complaint. I'm not so sure that I follow that theory, so I'm looking to perhaps move them closer to our campus.
And how do you monitor, just for quality control, just to make sure the officers are doing what they're supposed to be doing?
So we have an array of cameras throughout our facilities that are monitored, or they're recorded. They're on 24/7. The security and intelligence unit that I mentioned and our canine staff monitor those as well. Additionally, they monitor the telephones and they monitor tablet visits. So we have staff monitored. We are proposing to go to a body camera system, so all of our staff will have body cameras eventually. We are increasing our ranks of supervisors because we have more supervision, more sergeants and more lieutenants working in the facilities. Staff are just under more supervision, and we've implemented a process where the wardens and the deputy wardens need to be in their facilities. And this was not punitive, but this is something that I wanted. They need to be in their facilities in the early morning and late in the evening. So the wardens and their deputies split it up, and they each take time during the week to be in their facilities, eyes on staff, eyes on condition, eyes on the population, on off hours.
Well, before I turn over to my colleagues, Mike, I definitely feel that we're going in the right direction. Just the numbers that you're talking about, we've been working on this issue under the leadership of Councilmember and Chair of Public Safety, Councilman Curtis Jones. We worked through COVID and a variety of different issues, and I definitely feel the direction that we're going into. So with that being said, I'm going to turn it over to my colleagues. First person I want to call is Councilmember Isaiah Thomas, then Councilmember Jones, then Gilmore Richardson.
Good afternoon, Council President. Good afternoon, Council President. I want to first start by saying thank you to the Commissioner, to your entire team, to the admin, to the union representatives that's here, as well as the union representatives that are not here, for the work that we have done over the last year plus as it relates to prison oversight. We truly appreciate your partnership. We understand that this is not the ideal situation that you would probably want, but you haven't been moving with any resistance, and we appreciate the collaborative effort because we know it's important dealing with the conditions that we are here to discuss today. With that perspective in mind, can you provide for the public as well as for my colleagues in City Council detail from your perspective of what the ideal way a city or county jail should have oversight. What should oversight in an ideal way consist of for a city or county jail?
Thank you for that question, Councilman. And I know that this comes from a deep interest and caring about not only the inmate population, but also our staff. You and I maybe have a philosophically different approach to that. I think my testimony here during the hearing for the Oversight Committee, the charter change, I did mention that we do have oversight from our court monitors. Hopefully, we are moving in the right direction. We will be declared in substantial compliance, and that will end at some point. When that does end, and I've had conversations with the law department about this, I am committed to hiring independent experts that will come in and just review conditions and give us feedback on how we are doing, best practices perhaps in other areas, and recommendations to achieve those things. Additionally, we have the Pennsylvania Prison Society that comes on tour. They bring their monitors. They bring guests with them to tour. We've also have monitors out of the law department, Dr. Johnson and Dr. Perini, who come in and review the things that we're doing with regard to medical and mental health. So I am not opposed to oversight. I think we have a lot of it. I think that because a lot of the work that we do is done outside of the view of the public and behind the walls, the public has a right to know what it is that we do, and I'm philosophically not opposed to oversight. How we get there, maybe you and I disagree.
Thank you. We appreciate it. And again, the willingness to compromise has been an amazing journey thus far. And we do agree with the multiple layers of bureaucracy. And I think that's part of why we would like to see this board in place, so we can kind of remove some of the other bureaucracy that's in place and just have this level of transparency. There's been a number of issues in the prisons over some time, long before you've gotten there. Most of these issues and conditions, clearly you didn't create, clearly this council didn't create, but this is where we are, this is what we've inherited. I would like you to communicate to the public as well as to this legislative branch of government, what array of healthcare services do you provide and offer to inmates? How often are medical personnel serving patients in the prisons? And what initiatives are you spearheading that curb the spread of diseases throughout the prison?
Thank you for that question, Councilman. So we have a contract with a corporation called Yes Cares. Our medical and mental health care is contracted to this company. They have, what's the number? Over 350 full-time medical doctors, nurse practitioners, psychologists, social workers, nurses, and others, all licensed and credentialed the same way community offices and hospitals are. Our functional vacancy rate is around 0, which means we're fully staffed and we're able to provide care. All of our facilities are accredited by the National Commission on Correctional Health Care. That's only 600 out of about 7,000 jurisdictions. We also have a PHSW. It's our licensed 64-bed psychiatric inpatient hospital, and we also have a medical suite in PHSW that cares for inmates who have chronic conditions that might not allow them to be housed in general population. Sure.
Because I do want to do a deeper dive into some of the issues around healthcare, equity, and things of that capacity. More philosophical stuff than, tangible things, but I do want to respect the time. So, Madam Chair, if I could be put in the queue for the second round, that'd be deeply appreciated. And again, I just want to say thank you for the partnership, and especially thank you to the admin around prison oversight. Thank you, Madam Chair.
Yes, thank you so much, Councilmember Thomas. What I will say is, based on the amount of members in the queue, I will grant you an additional 2 minutes so that you're able to get those questions on the record in case we don't have a second round. Okay?
No, you want me to take the 2 minutes right now? Mm-hmm. Oh, excellent. Great. I'm sorry. I apologize. So when we look at some of the issues that we're dealing with in the prison, specifically looking at the healthcare and the services, why is it that we contract this stuff out? Why can't we do some of this stuff in-house as it relates to what we're doing to better service the inmates as well as the prisoners?
So we put the RFP out. The RFP will go out, I believe it's this year. The contract is up. So there are a limited number of folks that operate in this area. So the major ones, the bigger players who are able to deal with our population, the size of our population, the complexity of our population, it's open for anybody to bid. We could, entertain bids from, if Temple Health System wanted to bid, if University of Pennsylvania Health System wanted to bid, we'd be open for those models as well. But our staff, our local staff, regardless of the corporation that they're affiliated with, our local staff, the doctors, the nurses, the practitioners, all provide excellent health care.
There is a time, and we'll submit more questions in writing, specifically around healthcare injuries. We know that there's been significant issues. I don't want to alarm the public as it relates to those numbers, because that can be a different issue. I want to shift directions real quick. Prior to your leadership, there had been a lot of tension, and this will be my last question, Madam Leader. There have been a lot of tension between the leadership in the prison and the unions and the staff. Talk to us about your relationship during your time with staff, with the unions. What problems still exist? Where have you seen some improvements? And how could this legislative branch of government be supportive of that particular issue?
Certainly. So I think, and I'm not focused on the past. I hear the way things were in the past. I'm not concerned with that. I tell everybody that I'm looking forward, and I am, looking to the future to change things. So I think that my personal relationship with our union officials is very good. We have cooperative and productive labor management meetings. I am accessible to the union officials 24/7. They have my number. They can call me. We resolve issues. We don't necessarily agree on everything, but I do stress to them that they may be their members, but they're my employees, and their employee safety is my #1 concern. I think how this council can be helpful to us is a number of ways. So we need more staff. So if council members can get the message out to their constituents to go to the city's website and apply to become a correctional officer, that would be helpful. We discharge our inmates back into the community, right? It's only 13 miles up the road. They didn't go to Mars or anything, and they're going to be discharged back into the city of Philadelphia communities. So if there are ways that council members can talk to chambers, talk to labor unions, and perhaps have educational or vocational training programs for our inmate population, or jobs available for them when they return. We know if somebody has a job, housing, their substance abuse, their health, their mental health under control, the likelihood of them recidivating is very low. So employment is a key. So if council members can be helpful in that regard.
I think you have my word and other council members' word who's hearing that we will definitely be helpful. I'm hoping that when we do talk to the unions that their sentiment is similar to yours. And as I close out,
I hope so.
I think that it's important as we close out, and I'm sure another member will ask this, but you clearly have disgruntled people here at today's hearing who are concerned about issues related to the prison. I already asked you one question about health care. As I close out, talk to the members of council as well as the general public about what type of investigations take place when there's a death in a prison, and what type of communication do you require to have with those families?
So you can count me as one of those disgruntled individuals, Councilman. I'm not happy with the way things are, and progress is too slow for my liking. We are going in the right direction. I think that the staff can feel it. The numbers are going in the right direction. I would just like things to happen quicker. So in that regard, I guess I'm a little disgruntled as well. I want to see progress happen a lot faster. So when a death occurs in the prison, the Philadelphia Police Department come and they do an investigation, and our internal affairs office opens an investigation. The police department is looking to see if there were any crimes that were committed. Our investigation from internal affairs is looking to see if there were any policy violations that occurred that may have caused or contributed to the death. When a death occurs, our chaplaincy unit will reach out to next of kin. and advise them of the death. The individual's possessions and belongings will be returned to the family members, and I believe we forward the information regarding the medical examiners, because the medical examiners involved and may come in and do an investigation as well. So we give the family the method and means to contact the ME's office.
Thank you. Thank you very much. Commissioner, the chair now recognizes our Chair of Public Safety, Councilmember Jones.
Thank you so much, Madam Chair, and I want to, for the record, thank Member Thomas for his laser-like focusing on the problems both from the inmate, from the correction officers, and the union standpoint, and those people that have to deal with that on a daily basis. We visit, we walk through the tiers, we go home. They spend most of their waking hours there, so I want to thank you and your team and the correctional officers that do it on a daily basis. What I'd like to do is say, just real quick on oversight, and I've had some experience now with selecting people for the oversight of the Police Advisory Oversight Commission. And the most important thing I can say is pick your folk wisely. If they didn't walk a tier, if they didn't advocate it on a tier, if they didn't spend time in that facility, if they didn't work in that facility, you gotta kind of watch who you put on to make suggestions that affect their daily existence. Now, having said that, I'd like to shift back to what my colleague talked about, which is healthcare. As we put greater demands on the system to clean up hot spots like Kensington, and we're asking you to take on a greater role in the corrections aspect, and some of that is people experiencing detox. How are we preparing for folk that may come from that environment, be forced into a situation where they have to take their first detox in your facility? How are we preparing for that? How are we monitoring for that? How do we preserve life so that we don't have situations where people jump from the frying pan, literally, into the fire and have a shock to their system?
Certainly, Councilman, thank you for the question. So what we've started to do is, as we intake individuals as they come from whichever law enforcement agency is bringing them to us, usually the Philadelphia Police Department, but not always, we'll have a nurse come out and triage the individuals as they come through the Sally Port to determine whether they're medically stable enough to go through our process. If they're not, we reject them, and the law enforcement agency bringing the person needs to take them to the hospital to be assessed and evaluated, treated if necessary, and when they're discharged, they come back with that paperwork. We'll accept them.
I don't mean to interrupt you. What triggers, where's the floor to the ceiling to say, no, they need to go to the hospital? How?
I'm not a medical professional, so I don't want to guess as to what they do, but there's an assessment of an individual's vital signs, their medical condition, their history, if there's any medication that they've been taking, if they've been injured prior to coming to our custody. So
Is that for every inmate?
Everybody who comes in our door.
Okay.
There's an assessment that's made. If the person or the individuals are cleared for acceptance, they'll go through our intake process, and then they go to the medical unit where there's a series of in-depth questions that are asked. We administer to everybody the clinical opioid withdrawal test, the CAL score, scale, and anybody who registers a positive score on the CAL score is immediately started on Subutex for the withdrawal, and it's a taper. So while they're with us, we taper them up. They pass through medical, they're on Subutex if they're in withdrawing, then they go into intake housing.
So is there an isolation period?
Yeah, there's a...
Can you explain
sure.
how long?
So when you leave the receiving room, you go into intake housing in CFCF, and everybody who is withdrawing or on the Subutex, we've red armband. So we want them to be immediately identifiable to our staff and the medical staff. We've increased rounds on intake housing from the medical staff.
Describe that a little bit.
Rounds is a nurse who comes onto the unit, and she visits the individuals, she talks to them, takes their vitals, and makes a medical assessment of their condition. Individuals stay in intake housing, 7 to 10 days before when they're classified, and they're assigned their permanent bed.
Has there been an influx of individuals needing this type of treatment, and if so, how much?
I could get you that information. I don't have that readily available, and I will tell you, yes, there's been an increase in the number of individuals who we see in that condition. I will add, and I think I mentioned it briefly in the written remarks, that we are in the process of piloting a program where everybody who comes into the facility will be placed on a medical monitoring device. It looks like a big Apple Watch, and it monitors vital signs. For the first 5 days, everybody through our doors will be placed on this device. Their vital signs will be monitored. If they have a negative medical event, there will be alerts that go off in the housing unit for that officer, in unit management, and in medical. So there are redundant alerts. So we will, the idea is we will respond almost immediately to medical emergencies.
So my final comment before I pass off, has there been an influx, ebb and flow to this type of phase based on the drugs that are being taken, based on the number of people that we're bringing in? And if so, have we been here before?
I don't know that we've been here before, Councilman. I think that we're seeing more of our population. We intake about 18 to 20,000 individuals a year. So we could probably chart that over the year, or the individuals on our substance abuse treatment. So we can provide you with that information. One more point that I'd like to make is, because of the incidents and the nature of the drug supply, we've outfitted all of our correctional officers with Narcan. That's a new initiative.
How many deaths did we experience over the last 2 years?
In calendar year 2024, we had 6. One of those was a natural death in the hospital. One of them was a suicide. The investigation is ongoing, but from what I know of it, we could not have responded quicker. And the others I believe, are still under investigation. That is down considerably. I think there was a year we had 12 or 18? 18 was our high. I will note that our mortality rate is a lot less than the city's mortality rate as a whole, and a large portion of our population, 80%, don't have a primary care physician and have much higher than expected medical challenges. 40% of our population have chronic illnesses such as diabetes, hypertension, HIV, Hep C. 36% take medication for behavioral health illness. And the comorbidity of substance abuse is about 70% in our population. So we have a very medically fragile population, but our morbidity rate is, I believe, 3 or 4 times lower than the cities as a whole.
In the next round, Madam Chair, I'd like to visit reentry. I yield the mic.
Thank you so much, Councilmember Jones, our Chair of Public Safety. Thank you very much for your work. I'm going to skip myself for a moment to try to get to each of the colleagues for this round. So the Chair recognizes Councilmember Harity.
Thank you, my leader. Hello, everybody. Good afternoon. Just to make sure before I start asking my questions, do you guys manage the juvenile detention center also?
No, sir.
That's what I thought. Okay. There's 36 million has been requested for overtime pay in the prisons. What is driving this reliance on overtime pay?
Our post-plan, Councilman, if you take a look at all the positions that we need to fill, have correctional officers working in those areas, calls for about 1,500 and change officers. Our complement today is about 1,050. So while we still need to do things, we don't have the bodies all the time, so we use overtime to fill that.
Okay. And can you tell me more about this reentry trailer and what kind of services will be provided to the released population?
Certainly. So one of the things that I would like us to do is, and we're in the middle of a total reassessment of that division. We call that division Restorative and Transitional Services. Deputy Commissioner Jaco is in charge of that division. That's all of our social workers, our psychologists, our counselors, vocational and educational. We're in the middle of an evaluation, top to bottom, of that unit, and to determine what we are doing right, what we should be doing, and any changes that we need to make. I would like to see us do complete needs assessments on individuals as soon as they walk through our door, provide them with the services and treatment that they need and the education that they need according to those evaluations. When they are discharged from our care, all individuals will go to our reentry center. We will have that staffed with our staff, Officer Reentry Partnership staff, and community partners to ensure that when people leave our custody, they're followed up with linkages in the community to continue to provide them with the care, the treatment, therapy, the work that they've started behind the walls. That's the hope.
Yeah, it's good hope. I did have another question. I'm blanking right now. How many total officers are you short? Somewhere around 500, is that?
So we're about 500 off our post plan. We're around 1,050, and our post plan, I believe, calls for 1,576.
So, okay. And you guys brought up about jobs for the inmates getting out of prison. Do you have any partnerships now with any companies or anything like that where you have, that might be an idea, maybe?
I don't know that I don't think we have any partnerships with companies now. What we have is our skills center. Our skills center, we are revamping it so we're able to provide vocational education to the population. So we used to have, they would build an entire house in there. So it would be carpentry and masonry and electric and plumbing, and we would teach those skills. So we're going back to opening the skills center to provide those services, to provide that vocational education. And that's why when I made the comment to the Councilman Thomas's question as to what council can do to be helpful, if there are unions or employers in the city that would be willing to hire ex-offenders, we would like to partner with them.
Hell, us, we're short jobs right now. We'll hire ex-offenders, right? Yeah, so I mean, I get it. I get it. It's kind of funny that, you know, you guys are short. The sheriff's office is also short. Part of the sheriff's office problem of being short is actually because you guys are short. I worked for the sheriff's office, and we used to snake most of our employees from you guys because they're already trained. But thank you, and again, thank you for your commitment. Thank you for coming back to try to get this under control, and I look forward to seeing what you can do and how we can be helpful, and would really be curious on how we could actually maybe come up with a program for employment, because I agree. I mean, it's the same thing with the addicts out on the street. If you take the housing and the mental health aspect out of the picture, you'll have more succeed. It's the same thing with you. If they continue with their mental health and their addiction stuff, and they have a job with a stable housing, we'll have more people succeed. And I got to learn a lot about recidivism when I worked in the state for Senator Street. He was on the sentencing board, and I remember our first meeting, they were actually they were voting to give 10% more time to people because of their zip codes. We put a stop to that. It was actually not true at all. They were saying that people were more likely to recidivate if they were from low-income neighborhoods like mine. Which actually was not the case. It was actually the opposite. But here or there, I'm glad to see you're there and that we're going to be moving in a steady forward direction.
Thank you, Councilman.
Thank you. Thank you so much, Councilmember Harity. The chair now recognizes Councilmember Lozada.
Thank you, Madam Chair. Good afternoon. Can you tell me how many, what's your prison population? What's that number?
Today, our population, Councilwoman, is 3678.
And by any chance, do you guys have the breakdown of, by race?
Breakdown by race, I believe it is about inmate population. I think it is the last report that I looked at was from February. I don't know that we had our statistical report completed yet for March. I don't know that it will change much, but it was about 70% African American. Overwhelmingly, our population is male. It's about 92, 93%, maybe even a little bit more because our female population is down. And it's generally younger, 18 to 35.
18 to? 35. Thank you. I asked that question because I've consistently been hearing that there are non-English speakers in our prison population, and that there are no corrections officers who are able to respond to some of their needs. Some of these individuals suffer from mental health illness or substance abuse, and they and their families are saying that they are not being taken care of appropriately or adequately while they're in the system. And so I'm just trying to figure out where that's coming from. I want to say that I appreciate all of the changes that you all are making in the right direction, because some of the stories that we've heard, at least since I arrived here in 2022, were really scary, right? Especially for a population that can't go nowhere, right? They have no choice but to be there. And so thank you for the changes that you're making, but I want to make sure that, you know, as a city, we're able to respond to all of those communities that are non-English speakers. And so of the officers that you have hired, how many, do you know how many of them are bilingual or bilingual in other languages? And I don't mean that in just Spanish, right? In other languages as well.
No, I don't have that figure off the top of my head, Councilman, and I know we could provide it. It is self-reported, however. So if an individual does not tell our HR that they are bilingual or fluent in another language, we won't capture that. And they may be. But the system does use the language line, so that an inmate who does not speak English, or English may not be their first language, they can access language line and communicate to staff.
Well, we know the language access line is not the best way to do that, right? I mean, I'm just being really honest. We have challenges with that language access here. And so if we could consider looking at a better way, right? Or a more intentional way of being able to communicate with the non-English speaking population, that would be awesome. And then my last question, you were here a few weeks ago, you all mentioned providing some of those wraparound services to inmates as they re-enter into society. Can you tell us, for the record, what some of those programs are, and what is the, like, how successful have these programs been? How are you measuring their success?
Sure. I'll ask Deputy Commissioner Jaco. If you want to talk about some of our programs and how we're looking at success. I will tell you, Councilwoman, that the metrics that we had been collecting in the past, I was not happy with the method of the data collection and the type of data that we were collecting, because a lot of what we were collecting was, we were counting sort of outputs, like how many people went through a program. And that's fine. I want to know, did that program have a difference, and did it create a better outcome for that individual? So that's the type of data that we will be geared towards collecting going forward, to measure our programs, to see whether our programs are actually successful. It's fine to know how many people went through a program, but did that program have the desired effect that we wanted it to? Did it change that person in a positive way, that they did not come back, they did not recidivate? So I'll let Deputy Commissioner Jaco talk about some of the services we have.
Thank you.
Thank you, Commissioner. Afternoon. You know, I'll say that right now, as the commissioner stated, we are currently going through an assessment and we are reviewing all of our services. Wraparound services are not where we need to be. We are depending on our community and our volunteers to come in and help provide those services. So we work with numerous organizations to come in and work. They're providing job readiness, they're working on reentry plans, on housing, on identifying their needs, because each individual is different. And so they're working with them separately and providing those services, knowing that our contracts state that they must provide the wraparound services post-release. So that's what our contracts are looking at, is pre to post-release coordination of care. When we're talking about the reentry trailer, that is our focus for wraparound services, to ensure that there's a smoother transition. I really believe in the adage that it takes a village, and we all have to come together and work towards that.
Yeah, so in my office, we have an individual that comes in. I'm sorry, am I over time, Madam Chair? My last question. We have someone that comes in, we have a provider that comes into our office in the district every week to provide some of those services to folks who are reentering into society. And one of their biggest challenges is housing, right? And so if you could share with me what percentage of that population, as they're coming out, face challenges with housing, and how successful are you to connecting them?
Thank you for that question. I don't have the number. I will say it's extremely high. It is a huge need, so much so that we recently we changed a position to focus on roles specifically. Her job duties is for a housing navigation. She is currently assessing the landscape of the housing providers out there, the recovery homes, all of the options within the community, working with the social workers inside. So she's working within the 2 intake facilities so that she can identify individuals as they come in and as they state that they're unhoused or they need further assistance, whether it's transitional, long-term supportive housing, all of the different options. She's able to mark them down, start that as a caseload, and then work towards that for their discharge. She just started this month. So it's new. I will say that that's a focus, and that's why we pivoted that position and said this is what we're going to start doing. That's just in concert with the reentry trailer and all of the other efforts that we're doing. So we know it's a need. We don't have those numbers, though.
Thank you. Thank you, Madam Chair.
Thank you. Thank you so much, Councilmember Lozada. I'd like to put on the record that Councilmember Jones wanted to speak with the Office of Reentry Partnerships today. So if they are available for a callback, that would be excellent. Do we have anyone here from Office of Reentry Partnerships?
That's out of the Office of Public Safety, I believe, Madam Chair. They're not under the umbrella of the Department of the Prisons.
Right. I'm aware, but I wanted to make sure that I put it on the record that Councilmember Jones would like to ask a question of the Office of Reentry Partnerships as it relates to inmates that are released from our prison system. And so we will respectfully request a callback for the Office of Reentry Partnerships for Councilmember Jones, okay? The chair now recognizes Councilmember Driscoll.
Oh, thank you, Madam Chair. And Commissioner, it's been a pleasure working with you since you've been back. Our staffs are, working well together. Appreciate that. Very encouraged about the numbers of the new employees. We still have a ways to go there. And I will say, I think I can speak for my colleagues. We all have Facebook pages, and we announce job openings. So if your offices can share with us, as you're looking for recruits, we have a big following, and we'd be happy to share that on our pages.
Our recruitment coordinator will get in touch with you.
Thank you. Yeah, we'd be happy to do it. We have a lot of constituents looking for work. They come into our offices. Navigating the Philly.gov jobs page may be easy for some people, but it's not as easy for everyone. So to the extent that we can even use our offices to help people apply, we have most of us have district offices, and we want to participate. I would like to hear, as your district council person where the prisons reside, and as a family of 7 that lives up the road from you, I would like to hear about your perimeter improvements.
Okay. So
Those that have been completed and those that are contemplated.
certainly, Deputy Commissioner Buford can talk about some of our upgrades to our perimeter and what we have in store for the future.
Good afternoon. So the first thing we did was we addressed the PICC situation, which happened a couple of years ago, dealing with that escape. We fortified that perimeter. I don't want to go in detail, but we fortified that perimeter first. The next thing we did was we added perimeter cameras into our entire campus, and that is still an ongoing project. So where we did not have cameras regarding the perimeter, we added some with the help of capital projects and public property. So we have cameras on our perimeter based off of State Road and the wooded areas in the back of all of our campus. There is some other things that are coming that I will gladly get to your office. I just don't want to put them in a public forum. But I will gladly get to the office of some of the other security enhancements that we have made throughout the jail, throughout the whole campus. The other thing that we added that I can tell you is the way our roving perimeter patrols are now at every facility. We have the roving vans at every facility who stage at the facilities making roving tours. So that is some forward-facing things that the public can see.
And those perimeter patrols exist 24/7, so they are always out there, always on campus.
So you say on campus, is there any supervision, say, from Ashburner to little south of Ron?
Well, Ashburner at the end is where PICC is at the north end of our campus. CFCF would go down the Ron Street at the south end of our campus. So our vehicles are up and down State Road, are in and out of our drives, are around our driveways in the front and the back of our buildings. They are very visible to anybody who comes onto the campus or from State Road. You can see those.
Yeah, I mean, it's a deterrent. It works,
Yes.
so we appreciate that. Just lastly, can you comment, have we had any incidents in 2024 post-release? I know a lot of your former inmates get the public transportation on State Road at that shelter across the street. In 2024, have we had any, what I would call nearby incidents post-release?
I do not recall hearing of any. I don't believe we have had any in the year 2024.
Good to hear. I'm good, Madam Chair. Thank you, Commissioner.
Thank you.
Thank you,
Thank you, Councilmember Driscoll. I just wanted to put on the record, based on the callback request, and the reason for the acts, I think from myself and Councilmember Jones, is under Section 52, which is Philadelphia Department of Prisons, under Program Social Services and Reentry, for Class 250 for professional services. This is page 34. It states Office of Reentry Partnerships and is listed under the Philadelphia Department of Prisons. So I know that we'll get some level of clarification, but I just wanted to put that on the record that I believe that's the reason why Councilmember Jones asked. And I do see questions from a prior year about reentry partnerships as well. So I just wanted to clarify that, that under the budget detail that we have received from the Budget and Finance Office, that Office of Reentry Partnerships is listed under the detail for the Philadelphia Department of Prisons.
Correct, Councilwoman. There are certain positions in that office that we do fund.
Okay. Okay. All right. Thank you very, very much. The chair now recognizes Councilmember O'Rourke.
Thank you, Madam Chair. Good afternoon, Commissioner Resnick.
Councilman, how are you?
Good to see you, sir, as well as Deputy Commissioner Buford. Blessings to you all and all of the top brass of the Department of Prisons. Wanted to just, I think I overheard Member Lozada mentioning some things around housing supports, and I just wanted to hat tip my colleague for raising that. Was just having a conversation with some folks who were formerly incarcerated Monday night, and hearing things that were important to them, one of them being some of those particular concerns. So just grateful to hear that that's widely a concern for many of us. So let me dig in here. We have heard from a number of members questions around healthcare, and that's what I'm going to focus on today. Corizon, as they used to be called, Yes Care, as they are called now, the contracted healthcare provider for the PDP. I have questions for Dr. Herdman to start. Is Dr. Herdman here?
He is not here. Unfortunately, he is ill.
Okay. My prayer is that he gets better. I'll put it on the record, though, and to the degree that you can answer them, Commissioner, that'd be great. As I understand it, Dr. Herdman's office is responsible for ensuring Yes Care is in compliance with the contract. So my first question would have been, does he believe that Yes Care is actually meeting its required obligations under that contract? And so if you, do you have any opinion on that front?
I would let Dr. Herdman respond to that in writing and provide you a detailed explanation. But from the things that I see and experience, yes, I believe that overall they're complying with the terms of their contract.
It's a bit unfair because he's not here, and you are you have a number of things in your oversight as the commissioner.
I'm glad you understand that.
Yeah, I want to echo Member Thomas's points around our appreciation towards you in terms of the project that we've been working on over the course of the past year. That having been said, if that is his shared sentiment, that it is doing all right, I think that would be a disappointing answer. I got to put this on the record. We've had more than 24 deaths in custody since 2023. You know that. It's been a decrease, but that is still the case. And they've been sued, Yes Care, over 1,000 times nationwide for substandard care. Nationwide, 1,000 times, this particular organization. In the Inmate case, the healthcare provider at the prisons was found to violate the Constitution, and since 2015, the department inmate population has dropped over 55%, and in that same period, the cost of this contract has grown over 60%. So they're getting more money for, at least based off of what the reports are, substandard care that not only we're raising, but as I said, they've been sued over 1,000 times across the country. That is a concern. So under the contract, the city can essentially fine Yes Care for not meeting its obligations under Appendix G. What I would want to know is, has the department sought to fine Yes Care for failing to meet its obligations in the contract at any point during at least this administration? And if so, how often have we done that? When roughly was the last time that we did that?
So I don't know that the appropriate language is have we sued them. I think under the contract we can impose liquidated damages.
Fine them.
Yeah. We can impose liquidated damages or fines for failure to comply with contractual provisions. And I'll defer that to Dr. Herdman, and we'll get the chair and the councilman the response. But I will just want to mention certain or respond to some of the things that you said, Councilman. It's not surprising that they have been sued many times nationwide. They're a huge corporation. They're in lots of jurisdictions. They provide health care to a lot of individuals. If you're going to use the metric that someone gets sued so they don't provide good health care, University of Pennsylvania, I think, provides excellent health care. They get sued. Temple University, Einstein, Jefferson, same thing. They're in the business of providing health care. Unfortunately, that comes with the territory. They get sued. Just because you're sued, there's no indication of the quality of the health care. I will add that I believe, and I would have to check with the law department on this, that the number of suits filed in Philadelphia are low. Additionally, you talked about increased costs to the contract. That's because we ask them to do additional things, like we've asked them to do increased rounding. We've asked them to do access to care, so they're going to have staff that works with our team to make sure that the inmate population get to their medical appointments. Currently, right now, we are below the monitor's set targets for in-house medical appointments. The numbers that are waiting for in-house medical appointments is below the monitor's targets. We are making substantial progress in meeting the numbers for external clinic trips. 95% of the people who leave our system are enrolled in medical assistance, and they have behavioral health and physical health linkages into the community. So if the only metric is the number of lawsuits that the company endures, I don't know that is an indictment into the care that we provide locally. But again, I'll have Dr. Herdman respond in detail to your questions.
Thank you. Heard. Perhaps Sue happy folks may be. But I would say that every time a specialty care appointment isn't completed in 60 days, we could fine them $250. But according to the Federal Monitor, there were actually a total of nearly 600 of these backlogged specialty appointments at the end of 2024. That's roughly $150,000 sitting on the table on just one provision of the contract, though that ain't the point. The point shouldn't necessarily be about the money. It should be about the quality of care that we're providing our neighbors behind the wall.
And and not to cut you off, Councilman, but a factor in determining whether an inmate gets to go to that external medical appointment is if we have the correctional staff available to go on those trips. We are increasing the numbers of staff. I think we are now at 64% in terms of those external trips, meeting those. We have also started using a company called USI. They're used by the United States Marshals and other jurisdictions around the country to do medical guarding in the community. So even though our staffing levels may be low and not permit us to make all of these trips, we will utilize USI to further reduce that backlog. So I can't say that the backlog is all a fault of Yes Cares. It is a holistic approach, given that they can't do anything without our staff members. So we're trying to implement things that will increase that number by bringing on USI and having them take out the trips along with our officers and keeping our staff at the jails.
My buzzer done gone off twice and I sucked up my time. I'll just say that, heard, and I appreciate what workarounds you're trying to provide to be able to meet these things, to meet the need, but they've actually lost 20 contracts in recent years over substandard care. So they've lost, other folks have recognized this is an issue. And so I think we really ought to raise this up as a real concern. Again, this budget process isn't about one contract at any given point, but this one has really stuck out to us because, again, oftentimes people behind the wall are perceived almost as non-citizens. They're forgotten about, and the quality of care that they're provided, not just the conditions within the prisons, but the quality of care they're provided for the humanity, I think, is important. So we have to raise that point. I'll say this, I'll close it by saying that this body has long been committed to ending mass incarceration, and I think that starts with making sure that we do right by those behind bars, like Mr. Lewis Young, who died last November after going 6 days without his insulin under Yes Care's watch. At the same time, Philadelphia is a union town, yet we are contracting out a huge amount of work to the point that Councilman Thomas made to a company that in recent years split itself in half so it could pay pennies on the dollar for the hundreds of lawsuits it faced related to substandard care, deaths in custody, and even sexual violence committed by Yes Care employees, which is unacceptable to me. Doesn't it make sense to bring this work back to DC 47 members who are already doing great work in the city's health centers and are solely focused on people, not profits? I think that it does. That having been said, again, I thank you for answering my questions, and I know you ain't Dr. Herdman, but I appreciate you at least meeting me here in this moment. Thank you, Madam Chair. Thank you, Council President.
Thank you very much. Chair recognizes Majority Leader Gilmore Richardson.
Thank you. Thank you so much, Council President, and thank you again, Commissioner Resnick, for your work. And I wanted to notate also that we greatly appreciate, and I'll never forget, the tour that we had of the Philadelphia Department of Prisons with First Deputy Commissioner Buford. You probably don't remember this, but I was Chief of Staff for former Council Member Blondell Reynolds Brown, and you helped us with a tour during our staff retreat, and we thought everything was very well put together for us to really see firsthand what's happening in the prison system. So I wanted to thank you for that on the record, and to the entire team. We hear from a lot of individuals, families, a lot. We get a lot of constituent cases from families. We do receive some cases from time to time from staff as well, obviously regarding staffing concerns. And I just wanted to notate that. Very quickly, I just wanted to look at a few things in your detail. So I'm in section 52 of the FY26 budget detail. I'll start with page 34. That was the Office of Reentry Partnerships question. We just wanted to receive additional information on the reentry work and also how many folks are enrolled in any type of workforce development program currently in the prison system and or other certification program, because we know that skill building from a workforce development perspective is really important when we try to connect folks with work upon release. So if you could tell us just how many inmates are currently in a workforce development program or certification program.
Get that information for you, Councilwoman.
Okay, and I did see the information about the CDLA licensure certification program in your detail, and it was steady year over year, FY '25 and '26. But I know you all had mentioned, I think it was a year or two ago, about a barbering program as well that would give a certification skill to inmates. Is that up and running?
No, that's not up and running. We did have someone come down from the state to give us an assessment, but with the transition from the former Deputy Commissioner of RTS and Deputy Commissioner Jaco, we have to redo it.
Okay, just keep us updated on that, because I remember that coming up. It was either last year or the year before that we talked about.
Yep.
It was last year. I remember, without even looking through the transcript, that we talked about that certification program. But again, I just wanted to know for the record, I did see the forklift and the other certification. If you all could just notate, based on page 21, this is related to the Security and Operations Program regarding IOD. It's just $2 million, so it seems plain. If you could talk about the IOD number year to date for this year thus far?
I can get you the exact number, but what I can tell you off the surface, our IOD, which was in triple digits last year, is now down to just small, low double digits. Okay. So the IODs they've been coming back to work. And what we have changed is instead of, we use two work health facilities now. So we now use two. Before, there was a backlog of getting folks in for their appointments. So we use the Navy Yard along with another center to get the officers and staff seen.
Okay. And then I want to put 3 more questions on the record really quickly. You had a noticeable decrease in professional services. I'm specifically referring to section 52, page 22. Again, under security and operations for class 200, it was a little more than $2.285 million. And so I just wanted to put it on the record that I'm notating this significant decrease and asking what it's for, and where you are with your minority spend on your professional services contracts, since it is a significant portion of the security and operations Schedule 200 detail. And then I also wanted to ask about your vacancy allowance, because I heard the bell, your vacancy allowance, because I noticed how you all had moved around some of the positions in the class 100 earlier in the detail, and I'm specifically referring to section 52, page 18, and then section 52, page 19, regarding the vacancy allowance. That'll help me figure out that piece of the puzzle. And then finally, how many additional classes do you have forthcoming as far as new employees that will be working?
So our goal, Councilwoman, is to put a class in the academy every 6 weeks. So a class will start. Training is about 12 plus weeks, so midway through their training, another class will start. Once they graduate, soon after that, another class will start. So we're looking to do that, replicate that throughout the rest of the year.
I'm sorry, just the vacancy allowance, because literally I'm just trying to put the pieces of this puzzle together on page 18 and page 19. And I know it's 2 different facilities. I want to put that on the record. I'm aware it's 2 different facilities, but I just wanted to know your vacancy allowance that could help me figure out why it's listed this way for Schedule 100.
Sure, we'll get that for you.
Okay, all right, thank you. Thank you so much, Mr. President.
You're welcome. The chair recognizes Councilmember Brooks.
Thank you, Council President. I'm going to skip around. So my first question is, last July, the department announced that it had opened a 9-bed inpatient unit for people in prison custody at Jefferson Frankfurt Hospital. But according to the monitor's report from last week, not a single person in a Philadelphia jail was treated in that unit until February of 2025, when the PDP claimed 3 people were getting medical treatment there. So how many people have been treated at this unit to date, and what kind of care are they getting there? And why did you guys open a medical unit at Jefferson Hospital, then claim after the unit was opened that Jefferson couldn't offer surgical care the unit was intended to provide? And also, did you guys inquire about what kind of care the hospital could provide while planning to open this unit? Just trying to get clarity around this.
Good. Thank you for that question, Councilwoman. That was planned well before I got here, and that is correct. The hospital does not provide surgical services. Additionally, we don't determine the location of the hospital an individual goes to. If we have to send an inmate out, we'll call fire rescue, or our provider will direct which hospital based upon the services. So fire rescue determines, or our medical providers. We would ideally like to have that unit full, but since that hospital doesn't provide the range of services, or a full range of services, it's sort of limited. So, we have had conversations about the utility of continuing that contract. We've had people there. They will open it for us when we have, what, 2? Two individuals. The hospital will open the unit and staff it with nursing staff, and our correctional staff will be there. The point of that unit is every time we have to take an inmate to hospital and they become what we call an open ward, meaning they're admitted to the hospital, we have 2 officers on each one of those open wards. So if you have 10 open wards, that's 20 officers. If there's 9 in this ward, in this secured ward at the hospital, what do we have over there? 4, 5?
5 and 1 supervisor.
5 and 1 supervisor. So it greatly cuts down on our staff burden, but considering that we have had challenges filling it, given the services provided, we're questioning the utility of it.
Okay, thank you for that. And this is another question. We get these questions from community. So one of the questions is that why when families are visiting incarcerated friends and family, they can't take pictures?
No, ma'am. We used to have a system where you can discuss that.
So pre-COVID, we did have a ticketing system where they could take pictures, and it was a Polaroid, and they would buy a ticket and what have you. Post-COVID, when we opened back up slowly in-person visits, that was not something we had a slot for. The objective was to get families into the visiting area and let them see their loved ones. So that's something that will come down the line as we get back into full operations. But that was the reason why. It was a whole distancing thing, and we had to cut our numbers on how many people can be in the different jails, visiting rooms at one time. So that was the reason why.
So you're planning to
That is
reintroduce
definitely a down the line plan to reintroduce the picture taking back into it. And it won't be as before because it's hard to get Polaroids. There was a Polaroid type of system that we had. Certain supplies you can't get anymore. So, we're going to have to rethink how can we do it.
Okay. And I have one final question. I'm going to just go through the whole thing, and then you guys can answer it. According to the most recent monitor's report in December 2024, there was an average of 751 backlog appointments. This is some of what Councilmember O'Rourke asked. So the question is, how do you plan to tackle these delays? Is it a plan that are affecting people's health and in some cases contributing to untimely deaths? And our examples are Andrew Drury died on March the 9th. A little over a day after he was transferred for Quran Formhole. He was then labeled as an emergency medical case, and the medical examiner determined that his cause of death was from drug intoxication. So we were wondering how 3 days from Kensington, he died from drug intoxication while in custody. And we were wondering, was he taken to a hospital or medical treatment during his time in confinement, because that happens. And the other example was a Joshua Mister was arrested and held in custody this past Friday after trying to evade SEPTA fare in Kensington. He died by Sunday, and he had been in a hospital, but was released. Joseph Gabor was taken in on a Kensington sweep, and shortly after he passed away, Amanda Cahill was arrested in the sweep, died a few days later. So there's a pattern of people being arrested in Kensington and then dying in jail not long after. In the case of Michael McKinnis, he died overnight in an unsupervised jail cell. So what I'm trying to understand is, are there new policies and procedures that can be put into place in order to end this pattern of people dying from opioid-related complications in jails? And I know it's short staff. I did the tour. I've seen the whole thing, and I'm not kind of placing fault, but we have to find a solution. You know, like,
No,
we can't continue having
I
this
appreciate
pattern
the-
of deaths in the prison system around something that we could kind of plan for.
I appreciate the question, Councilwoman, so I'll answer your first question first with respect to our backlog. As I mentioned, our backlog of on-site medical care is now below the goals set forth by the federal court REMIC monitors. So we are well below those ranges now. So we've met that, and we will continue to meet that. How we are meeting that is we have assigned a major, deputy warden, who's in charge of access to cares. He works with the Yes Cares team and our custody staff to ensure that people who have medical appointments come out of their units, come off of their housing blocks, and are seen in their appointments. So we're ensuring that. Yes Cares is also hiring access to cares individuals who will work with that major to do that work. We have also tackled our external clinic trips. We've met, I believe it's 64% of them last month. So that backlog is coming down. The report that you mentioned, and the problem with these monitor reports is because they look at a snapshot in time, then several months later they issue their report. The report is historic already because we've already made progress. So the progress that we are making now won't be reported until September, because that's just the way the timing of the monitors and the timing of the reports. So the numbers that you see in the reduction of those backlogs will be reported in the monitors' reports come September, but we're doing it now. In addition, as I said, we are working with USI to help augment our staff to take inmates out to the community to have their appointments, and also to sit on the open wards. That does two things. It allows us to get those trips and those services for the inmate population, but it also, utilizing USI, allows us to keep staff at the jails on housing areas, having those areas open and having the inmates out of cell time increase. It allows us to do those two things. So I think that's my answer with respect to how we're tackling the backlog, and I think you can see from the numbers that those backlogs are coming down. The respect to the cases that you've mentioned, as I'm sure you can understand, I can't talk about opened investigations, but what I will say is we have done a number of things at the prison system. As I said, anybody who comes in and scores a positive score on the CALS assessment is immediately started on our medical assisted treatment. We've red armband everybody in substance abuse treatment. So they're easily identified by our staff and medical staff on the housing units. We've increased medical rounding on those housing units, and we are undertaking a pilot program to outfit all newly admitted inmates with medical monitoring devices that will monitor their vital signs, and we will get alerts, redundant alerts in different places if an inmate is having a medical incident, and we will be able to respond immediately.
I'm glad you guys are taking steps in the right direction. And to the something that you mentioned about the hiring policy, what does it look like? You said you want a class every 6 weeks. How is that going with recruitment?
So that's going amazingly well. We've hired We have Mr. Robinson as our recruiting coordinator, the handsome man in the blue suit right there. He works with our community partners. He works with council staff. He works with schools, businesses. He goes to all around the area to job fairs. We have the ability to hire outside of the city of Philadelphia, so we're recruiting in other areas as well. Mr. Robinson also works with the Walls Group, which was the recruiting firm that we've associated with, who has expertise in law enforcement and corrections, to work with our background unit to expedite the cases. So what you're seeing is, we've had classes of 30 and then 40 and then 50, and now it's 74. So we're keep increasing the number of classes, the numbers in the class, and the frequency of the classes.
And what does the retention look like? Are people staying?
Our retention rate is down to single digits. I think it's been running between 2% and 3%. We're trying to do a lot for our staff to make them feel valued, to make them invest in their personal well-being, their professional well-being. We've changed where we do our training. It's now in a updated, state-of-the-art facility. We opened a wellness center for our staff. They can use that facility to work out, to do cardio. We've appointed a wellness director who will be providing classes that staff say that they want to have, whether it be weight loss, smoking cessation, healthier eating, just things that staff have an interest in to keep them and on the payroll.
Thank you so much for that.
You're welcome.
Thank you. The chair recognizes Councilman Ruth Landau, then Councilman Lozada, and then Councilmember Young.
Thank you. Thank you so much. First, thanks for being here. Council President, I hope you heard that. They have an exercise room, a cardio room, and a variety of other things. So maybe we'll get that soon too.
Sure, as long as y'all come on time.
I walked right into that. Okay, I have 3 questions for you. And the first I want to start with, because you were talking about recruitment, training your new classes for 12 weeks. I wanted to talk about how much you're investing into de-escalation practices and other kind of restorative practices or different kinds of justice to make sure that we can resolve conflicts without it getting out of control.
Sure. So that is part of our use of force training. We did have a large class of crisis intervention training, train the trainer. I forget how many months ago that was brought on board. So our staff now have been trained to do that training. So we have individuals who have already been trained, deployed in the facilities, and our staff at the training academy are certified to do that training. So we roll that training out with the new classes. Obviously, the CIT training is, I think it's 40 hours. It's an entire week. We roll that training, we incorporate it into the new cadet training when we're talking about use of force. We have, I think it's about 12 weeks almost, our training. One of the things that I would like to see our academy increase, I know that doesn't sound intuitive because it takes longer to get people in, but I think if we train people, we provide them more training, we prepare them for what it is, the job we expect them to do, right? I don't want to shortchange training and then people get inside the jails and say, I didn't expect this, you didn't prepare me for this, and after we've made that investment in recruiting and hiring and training, they leave. So I want to make sure people are adequately prepared, and it's a debate amongst the people in this room with me about increasing the length of our training, but ultimately I would like to get us there.
Thank you. 2 more questions. One is, I was unclear, we allocated money, you requested last year money for body-worn cameras. Did you purchase them?
No, we did not.
And is the intention to purchase them this year?
Yes, it is.
For all staff?
Ultimately, through the life of the plan, yes, for all staff. I think the initial rollout with DC Beaufort and DC Nash is we would put them in the receiving room and our special management areas first, areas where we know we traditionally have more issues, more uses of force to protect both staff and inmates. So those are the areas where we will roll it out first. And then as we move on into the out years, general population areas.
And where is the intention that you would, I'm the head of the tech committee, is the intention you would store that data, that footage with the police department's footage, or you would have your own storage for that?
I think it's our own storage. We would piggyback off of the systems, the same vendors, but it would be our storage.
And then the last question is, do you have an intention of using drones in the prisons?
We have 4 drones currently. They would be tethered to the buildings. They would be up essentially 24 hours a day, weather permitting, and providing real-time monitoring of the external facility.
That's great. Thank you very much. I'm good for now.
Thank you, Member Lozada. Chair recognizes Councilman Ketzi Lozada.
Thank you, Council President. I just want to get these 2 questions on the record. They're not related, but want to make sure that I'm able to respond to folks who have made inquiries. Number 1 is, how much are incarcerated individuals getting paid for work detail? Number 2, according to your testimony, there was an average rate of 120 daily out-of-service cells in 2024. What is that number now? And then when we last spoke, 60% of the population was substance abuse dependent. Has that number gone up, stayed the same, or has it gone down?
I'll address your last question first, Councilwoman. I think if you said 60%, my records show it's 70, so if that's the case, it went up. With respect to inmate pay, I believe we're paying $2 a day, and our out-of-cell numbers, I am not sure we'll have.
You said $2 a day?
Yes, it's $2 a day for our general work, and then our specialty work in our industries area, they actually get paid by the hour based on the craft. Some of it is 45 cents an hour, and some of it is, I think, 55 cents an hour. But general work, which is general cleaning, food service, that's $2 a day. It actually went up. It used to be $1.50 as of last year. It was $1.50 a day, and we asked for the increase, which it went up to $2 a day. The out of work cells that you see, we are actually in a capital project. We have some cell doors that are mechanical in nature, that we had to change all of the motors and all of the sliders. They don't open up like a regular door do. These actually slide. So that project is ongoing. So that's the out of cell numbers that you see, but it's down to only 60 now.
60?
Yes.
And I'm sorry, I didn't hear your substance abuse number.
70%.
It went up. Okay, thank you. Thank you. I just wanted to get all 3 of those on the record. Thank you, Mr. Chair.
We'll be at ease. Chair recognizes Councilmember Young.
Thank you, and good afternoon. Just a few questions just about the workplace environment there up at our prisons. Can you tell us, is there a difference in pay between officers who work 12 hours versus officers who work 8 hours?
Yes, Councilman.
And why is there a difference in that pay?
The way our contract works is we go before a panel of arbitrators. The union makes a proposal, the city makes a proposal, and 3 arbitrators craft a contract for us.
But their rate is the same, or the rate different?
The rate is the same.
The rate is the same.
The rate, yes, the rate is the same based off of their years of service.
So even if I'm working 12-hour day or 8-hour day, I still get that same rate?
So
Okay.
if I'm a 10-year officer and you're a 10-year officer, we both have the same flat rate. But you chose to stay at your 8-hour post 5 days a week with weekends and holidays off, and I chose to do the 12-hour post. You're getting extra, I'm getting extra money because, one, I'm doing 4 hours more, and there's a more, they've gotten, based off of that arbitration, they got a little more money in their differential. So that's where you see the difference at.
Okay, thank you. Can you tell us about, I know we have this shortage, but can you tell us about the standards that you have when doing recruitment? Because my office has gotten information that standards have extremely and drastically lowered, which created some of this, the issue with retention, because some of the folks who are applying may not be, strong enough, right, or have that mentality, to work there in that type of environment. I mean, I was told that there was, folks who were, close to 400 pounds who were applying, folks who don't speak English who are applying without any assistance, and, folks who are in their 70s, right, who are applying for these jobs. So could you talk to us about, some of the standards?
Sure. So I don't know that, well, you need to speak English to be able to work at the Philadelphia Department of Prisons. And there is a physicality portion of the training. So you need to pass all of the academy training, and part of that is physical fitness.
But were they lowered? As a question of were those particular standards lowered in order to allow some more folks to be hired to kind of fill those jobs?
Yeah, DC Buford can address that. I believe that some of the standards were relaxed just to get larger applicant pools. But again, like I said, those applicants could apply, but you still have to pass all the training. But DC Buford can speak to that.
Yes, Councilman. As you know, when we were in our crisis mode 2-3 years ago, and we were putting out job announcements, we were getting nothing. If we put out a job announcement and let it run for the standard 2 weeks, we may have gotten 200 people that applied. Once we vetted them the way we normally do, we wouldn't get anyone. So we had to try to lower some standards as to get a bigger applicant pool. So what did that entail? Well, there used to be a written test, a written civil service test to become a correctional officer. That test is not existing right now. We did have to relax some of the weight requirement, because we were not getting anyone for this particular field, this particular profession. So we did have to relax it. But what do we do on the back end? So on the back end, our training academy, so to make sure that the person can pass the basic skills while in the training academy, they had to pass their physical fitness requirements, their weapons requirements, their testing requirements. And if they didn't meet any of those requirements, then of course they didn't make it past their probationary period. But that's where we're at right now.
Can you talk to us about the air exchange that happens? I know there are a lot of inmates, who smoke whatever they smoke in jail, right? It's not, just cigarettes and marijuana. It's other chemicals that they're smoking, and that is affecting the correctional officers as well, who inhale these things. So can you tell us about the air exchange at the prison system, and what can be done to protect some of the correctional officers?
Sure, DC Buford can talk to you about the system for air exchanges, but let me just address the fact of the portion about contraband. So I did mention earlier that we've acquired machines in our mail rooms that will check all the incoming mail to determine if it's been adulterated with any substances. If it has, if it's legal mail, we identify, we let the inmate and the sender, because it might not always be a legitimate law firm, know that the mail has been confiscated and it's returned or destroyed, and the inmate is notified. Other mail, if it's adulterated, if there's any problem with it, the inmate's notified and it's destroyed. We have, as I said, increased our canine unit, and we have a unit specially assigned to detect and interdict contraband. We have an entry procedures unit now that checks all staff, all contractors, all visitors coming into the facility. So we're making a huge push and a huge concerted effort to reduce the amount of contraband available and to make the environment safer. But in the incidents where inmates are smoking, which they shouldn't be, DC Buford can talk to you about the process of air exchanges.
Yeah, so the facilities, 3 of the major facilities, CFCF, RCF, and PICC, which are air-conditioned jails, have a system where when they start smelling smoke, the staff smell smoke, they make the call to the shift commander and maintenance, and then the maintenance team can reverse the air, in which case they let fresh air come in from outside, which will vacuum out some of the bad air. It's not a perfect system, but that's what we do. The second thing is, wherever the area is, we start the search process. The search process, the housing area that we're smelling the smoke, we need to do a search on that area to see if we can find the contraband. Now, most of the time, they know we're starting the search process, the flushing of the stuff goes, commences. That's how the air exchange process works. Now, at the detention center, partial of the detention center is air conditioned. The dormitory side, which will be air conditioned shortly, is fresh air coming in through the windows. The detention center is all window made. So, of course, we open the windows. We use big fans there to try to get the smoke out of the area. But I want to be clear with something. It's not like it's you walking through a plume of smoke. That is not the case. But the smell is the smell, okay? And we encourage staff, the minute you smell something, say something. Don't let it permeate in the air, too long. Say something immediately so we can start the process.
Thank you. And I only asked that question because I know, again, it's not just like marijuana or cigarettes. People are smoking K2, smoking chemicals, whatever chemicals they get their hands on. And so that affects the air quality for everyone in there, right? And so just want to make sure that these systems in place are actually working to clear the air because, someone died because of that, right? An officer died because of that, right? So, we just want to make sure that these things are clear.
You finished, Member Young?
Yes, Mr. President. Thank you so much.
Thank you. Chair recognizes Majority Leader Richardson.
Thank you. Thank you so much, Council President. I just wanted to put on the record, I had this written on my sheet for thank yous, and I neglected to say it in my transition, but I wanted to thank David Robinson for all of his work and help and really deep touch points in the community that help us reach out to folks who wouldn't typically be, interested in being a part of this work. So I wanted to say thank you to David Robinson. And like I said, I had it written down on my paper and just was going back down memory lane, thinking about that last visit and just how great you were to our team, First Deputy Commissioner Buford. So thank you, David Robinson. And I also just wanted to state for the record, based on Councilmember Young's question, because I was reviewing this in the detail as well, on Section 52, page 21, under Schedule 100, regarding the amount of full-time positions, and that was another reason why I asked about the vacancy allowance, because of the FY26 budgeted positions, and then overtime, which we know is around 34 million, and the shift and stress differential. So is that one and the same, or is just listed under the same pot of money, the shift and the stress?
Yes, it's listed under the same code, yes.
Okay, and I got that off of the same page with the IOD question, so when he brought it up, I just wanted to make sure I got that on the record. But thank you very, very much, and thank you, Council President.
Thank you very much. Any other questions or comments from members of the committee? Member Harity? Okay. Well, thank you very much for your testimony. Continue to keep moving forward the progress that you're making.
Thank you.
Thank you.
Thank you, member.
The chair recognizes Councilmember Gilmore Richardson for a motion that the public hearing and meeting on the bills and resolution before the committee today stand in recess until April the 15th, 2025 at 10 a.m.
So moved, Mr. Chairman.
It has the moving property seconded that the public hearing and meeting on the bills and resolution before the committee today stand in recess until Tuesday, April the 15th at 10 a.m. All those in favor signify by saying aye. Those opposed, the ayes have it, and the motion carried. This committee will stand in recess until Tuesday, April the 15th at 10 a.m. Thank you very much, everyone, for being here.